Welcome to this tutorial on medications for high blood pressure, types and side effects. High blood pressure, also known as hypertension, is a common condition that affects millions of people worldwide. If left untreated, it can lead to serious health problems, including heart disease, stroke, and kidney damage. Fortunately, there are several types of medications available to treat high blood pressure. In this tutorial, we will discuss the different types of medications for high blood pressure and their side effects. Types of medications for high blood pressure. Diuretics. These medications help your body get rid of excess salt and water by increasing urine production. They are often the first line of treatment for high blood pressure. Some common diuretics include hydrochlorothiazide, chlorthalidin, and furosemide. ACE inhibitors. These medications relax the blood vessels, allowing blood to flow more easily and reducing blood pressure. Some common ACE inhibitors include lisinopril, enalapril, and ramipril. Angiotensin II receptor blockers ARBs. These medications block the effects of angiotensin II, a hormone that constricts blood vessels and increases blood pressure. Some common ARBs include losartan, valsartan, and candesartan. Calcium channel blockers. These medications relax the muscles of the blood vessels, allowing them to widen and reducing blood pressure. Some common calcium channel blockers include amlodipine, diltiazem, and verapamil. Beta blockers. These medications slow down the heart rate and reduce the force of the heart's contractions, which lowers blood pressure. Some common beta blockers include metoprolol, atenolol, and propanolol. Side effects of medications for high blood pressure. Diuretics. Side effects of diuretics may include increased urination, dehydration, low potassium levels, dizziness, and fatigue. ACE inhibitors. Side effects of ACE inhibitors may include a persistent cough, dizziness, fatigue, and skin rashes. ARBs. Side effects of ARBs may include dizziness, low blood pressure, and kidney problems. Calcium channel blockers. Side effects of calcium channel blockers may include constipation, nausea, headache, and dizziness. Beta blockers. Side effects of beta blockers may include fatigue, dizziness, and shortness of breath. It is important to note that not everyone will experience side effects, and some people may experience different side effects than those listed here. If you experience any side effects while taking medication for high blood pressure, it is important to speak with your doctor. In conclusion, there are several types of medications available to treat high blood pressure. Each type of medication works differently and has its own set of side effects. It is important to work with your doctor to find the right medication and dosage for you, and to carefully monitor your blood pressure and any potential side effects. With the right treatment, high blood pressure can be effectively managed, reducing the risk of high blood pressure.